The lack of adequate rehabilitation for the children, particularly those with the most severe impairments, is appalling. If they had been properly assessed at the time of their admission into a children's home, if they had been periodically assessed by a team of specialists that is required in such situations, if they had been given individualized programs, because each child is a case in itself, and physicians and psychiatrists can help with only one side of the problem, but we need physiotherapists, we need speech therapists, we need lots of specialists to be involved in the rehabilitation of these children, who will then be able to rejoin their peers in the community and live a life with dignity.
A particularly alarming practice noted by Amnesty's psychiatric consultant has been the use of drugs as a means of controlling rather than treating the residents.
Това ние наблюдаваме на най-разнообразна картина. В някои домове се използва масирано и в големи мащаби използването на седиращи средства с цел потискане агитацията на пациентите, и това в големи мащаби е неоправдано. В други домове, ние, като например Драгаш войвода, ние наблюдаваме един друг начин на справяне с ситуацията от страна на персонала, и това е физическата имобилизация, както и изолацията.
This is an operating isolation room in the social care home in Samuel. The woman filmed here had been left sedated in darkness for an undisclosed period of time.
И може ли да разкаже нещо? Какво беше това?
Канцер.
Канцер.
Не, е такова. Айде, затваряйте ма.
Затваряйте.
Не. То спакенче сами да колани, с колани, дето се завързват, и с чинджири, и с бастуни, дето е така.
И кой направи това?
Старшата. Старшата всичко обърка дома.
Старшата?
Всичко обърна.
И шефа?
Да се закри тук дома.
Как се казва?
In all the institutions that we visited, the use of restraint and seclusion was in violation of international principles in this field. Even in the homes, such as Cherniver, where the conditions were fairly acceptable and where the staff was very caring, we found appalling use of restraint and appalling use of seclusion. Women had been held in cells that are literally small narrow cages for very prolonged periods of time, several months at a go. One woman had been detained there in a tiny corridor for over a year. In the room next door, we saw a woman who had been chained to the wall, sitting in bed, and she had been there for a year in that position. She had been given very high dosages of psychotropic medication.
We have witnessed in a number of places that there were new seclusion rooms built recently with government funding, with funding from private institutions for this particular reason. As a rule, these seclusions and restraints take place without order by a doctor, without order by any medical personnel.
Overseen by the Ministry of Labour and Social Policy, not the Ministry of Health, Bulgaria's social care homes suffer from a lack of qualified medical staff. Institutions are forced to rely on poorly trained orderlies, and even these are in short supply. Under pressure and working beyond their capabilities, the result can be violence and abuse.
Да, това е проблем, който наблюдаваме във всички институции. Единствената разлика е, че може би в някои от тях упражняват насилие само няколко човека от персонала, а на други места това е обща практика. И това главно се дължи на подбора, по който се извършва подбора на персонала в тези домове, защото те са предимно хора, които живеят в селото и които могат лесно да пътуват до дома. Те обикновено нямат образование, което е подходящо за занимание с хора с психически проблеми и умствена изостаналост.
Разбира се, ние ако питаме персонала, те ще кажат, че главният проблем е в липсата на финансиране и това е, за съжаление, един много трагичен факт. Въпреки това, аз лично смятам, че това не е водещото, водещото е личната отговорност.
But it is the mortality rates within Bulgaria's social care homes that best illustrate the weakness of medical provision for their residents.
Okay, but the one that is up here, this was somebody who died last month, is that right?
If you look into the mortality rate, you will see that a big number of these deaths occur during the winter. And this is by itself very indicative, both of the material conditions that these people face and of the medical care that they offer. They die in the winter of cold and of hunger in some cases and of neglect.
But it doesn't have a date, is that right? Yeah. So what the director of the institution was basically telling us is, look, they just leave the bodies here for 2 days. We call a doctor, they come in, they give us a death certificate, we get a stamp from the mayor, and we bury them in the institution. A burial doesn't even mean a burial, just simply putting people in the ground. But there are about 20 women that are placed, scattered all over this area here. We noticed up there that there's one cross for one of the women who died in January, and we've seen a couple of these what is supposed to apparently have a name and a date of these people, but clearly there's nothing on here. We do know that 3 people died this year, and it's not clear exactly where they're buried, and we know that above they don't even have her name, her date, nothing to indicate who this person was.
The violation of human rights seen in this film and detailed in Amnesty's report stem from systematic discrimination against people with mental disabilities. Currently, the residents of these homes have no chance of reintegrating into society or of fulfilling their potential. In this regard, Bulgaria is failing its obligations under the various human rights treaties to which it is party.
We need an institutional reform from the top to the very low level of management of these institutions. We also need deinstitutionalization program, especially for the children's institution.
Това, което виждаме или вие виждате днес в България, е нещо, през което са минали Великобритания, Германия, Америка. Ние имахме контакти с наши колеги от Mental Disabilities Rights, една международна американска организация, които ни казаха пред същия проблем институциите, детските институции, бяхме изправени и ние до 70-те години. И тогава започна една промяна в обществените нагласи, чрез разяснителна дейност, чрез кампании, по всякакъв начин, разбира се, и с подкрепата на държавата, за промяна на нагласата, за промяна на социалната политика.
We need to now extend our hand and support to the Bulgarian authorities and encourage them to accelerate a reform of the mental health care system in Bulgaria and to ensure that this reform complies with all the international human rights standards.
As any human rights issue, this is a matter of international concern, and that the international community must pay attention and take action also, because these are human beings. A human rights problem is an international problem.